Greetings of peace. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good day to each and everyone. So for today's video, we will discuss the Unit 3 of Fundamentals of Nursing entitled The Nursing Process. So let's identify first our course objective or your unit objective. At the end of the course, in given simulated conditions or situations, the student will be able to understand the concepts of nursing process, describe each component of nursing process, explain the relationship between critical thinking and the steps of nursing process, communicate to clients following effective therapeutic communication skills, express appropriate assessment finding through proper documentation, show efficiency in coming up with a nursing care plan, utilize nursing process for the care of clients holistically, design an individualized nursing care plan that would promote optimum care to clients, and demonstrate accuracy when documenting assessment findings and other pertinent data. So now let's go to discussing our nursing process. So what is nursing process? Now, nursing process is a systematic, rational method of planning and providing individualized nursing care. Again, it is a systematic, rational method of planning and providing individualized nursing care. Now, there are two components that are needed, for nursing process: the critical thinking and critical reasoning. Now, let's define these two requirements in order for us to implement nursing process. First, critical thinking. Now, critical thinking is the process of intentional higher level thinking to define a client's problem, examine the evidence-based practice in caring for the client, and make choices in the delivery of care. Again, it is the process of intentional higher level thinking to define a client's problem, examine the evidence-based practice in caring for the client, and making choices in the delivery of the care. So, critical thinking uses more abstract, more higher level of thinking in order to understand the patient's problem, in order to understand the client's need. While as your clinical reasoning is the cognitive process that uses thinking strategy to gather and analyze client information, evaluate relevance of the information, and decide on possible nursing actions to improve the client's physiological and psychological well-being or psychological outcomes. Now, in comparing of these two, critical thinking is all about the intentional higher level of thinking. The ways and understanding the way thinking for the case of the patient. While clinical reasoning, is the cognitive process in which we use the thinking strategies to gather and understand and analyze the data. To analyze the data that we have gathered during the assessment phase. So that is the two needed components of your nursing process. Now, why do we need to do nursing process? Or what is the rationale or reasons why do we implement nursing process? First is to identify a client's health status. In this way, we can identify if the client's health status is good, poor, or needs more improvement. Another is to establish plans to meet the identified needs. Now, we have different phases of nursing process. This I have already mentioned this one in the previous topics natin. So we have assessment, diagnosis, planning, implementation, and evaluation. Now, after gathering the data about the patient, we will now plan for our goals and objectives. Doing that, we need to establish plans to meet the idea or to meet the needs of the patient. So our plans should be focused on the needs of the patient. Okay? Another thing is to deliver specific nursing interventions. In planning, I mentioned we plan for the objectives, the goals, and we also plan for the type of nursing interventions. Now, when we talk about nursing interventions, there are three specific interventions that we need to identify. First is your independent nursing interventions. So these types of intervention is done solely by the nurses. It doesn't need a doctor's order. It doesn't need a collaboration with other members of the healthcare team. That is independent. While we have another type of nursing intervention, the dependent nursing intervention. So from the word dependent, these are type of nursing interventions that are dependent on the physician's order, our partner in rendering services to our patient. And lastly is your interdependent nursing interventions. These are nursing interventions that needs collaboration from the collaboration with the members of the healthcare team. Now, let's talk about the phases of nursing process. So we have the mnemonics ADPI. A stands for assessment, D stands for diagnosis, P stands for planning, I stands for implementation, and E stands for evaluation. So let's start first with our phase. Again, this nursing process should be done systematically. You cannot skip a phase. You cannot go to another phase if you hadn't done your assessment. You will always start with assessment. So let's define what is assessment. So assessment is the process of collecting, validating, and recording data about the client's health history and health status. Now, how do we get this assessment data? Through collecting the data through observation, interviewing, and examination. So again, the assessment phase is all about gathering data from the patient. Either it can be a subjective data or objective data. The goal is to understand, the goal is to have a baseline data about the health status of the patient. So we can use observation, in which we use our sense of sight, and auditory and olfactory also cues are also included. We have also interview process, or interviewing and examining, or our head-to-toe assessment. Now, there are two types of data, namely subjective data and objective data. So let's start first with your subjective data. So in this video, in this sample that is shown here, this includes the subjective data. So the patient's profile, we have the health habits, the chief complaints, history of present illness, summary of interaction, history of past illness. So these are just some of the subjective data that we can gather from our patient. So subjective data are the types are the datas that are provided by the patient solely, and this can be only verified by the patient only. So for example, the patient's profile, okay, the feelings, emotions, the concerns of the patient, these are all types of subjective data. The main source of subjective data is the client, and the only one who can verify the data itself is the client. Okay? So, example again, we have here the health habits, the chief complaints, and the history, because the patient is the only one who can tell you how did it happen. The disease, the process itself, he or she can tell you what was the problem. While your objective data, these are types of data that can be measured or tested against an accepted standards. With the use of your physical assessment or your physical examination with the techniques inspection, palpation, percussion, and auscultation, or inspection, auscultation, percussion, palpation, with the use of that physical assessment techniques, you are able to gather objective data. So from the word objective, these are the data that can be observed, that can be measured, and can be tested or compared to a standard or accepted standard data. So again, we have here inspection. So inspection is a technique where we use the sense of eyes or sight. So it is a visual examination of a certain body parts with the use of your sight. While as your light palpation is a type of examination that uses the sense of touch. You feel, okay, the shape, the characteristics of a certain body parts. Now, it can be light palpation or deep palpation depending on what we are assessing. If we were to assess the moisture, the dryness, what do you call this? Superficial part of our body, we usually use light palpation. Now, if we were to use deep palpation, we assess for shapes, for dense organs such as liver, the spleen, the gallbladder. Okay? So we have also the percussion, the act of striking an object to a certain body parts to produce sound. And these sounds are identified. These sounds are characterized depending on the area or the characteristics of the sounds that we hear. Now, there are 4 components of your percussion sound. First, we assess for the amplitude. How loud is it? Okay? The next one is the quality. You have to describe the quality that you have heard during percussion. The next one is the duration. How many times or how many seconds did you hear the sound itself? So again, we have amplitude, quality, duration, and pitch. If it's high-pitched or low-pitched. Now, we have different characteristics of percussion sounds. Namely, it can be a dull or dullness. It can be hyper-resonance. It can be a resonance. It can be a timpani. And can be a flat. Now, if we were to differentiate these 5 characteristics of percussion sounds, flat usually heard when we percuss muscles or bones, okay? Because it is not hollow organs. While your timpani is commonly heard when we percuss our abdominal area, namely, mainly our stomach. Because it is a hollow area or hollow organ, so it may be it may have fluid or air. Okay, that's why it produces timpani sound. Now, for your dullness, this is usually assessed when you're percussing the liver and the spleen because these are dense organs, meaning there's no space in the middle of this type of organ. Now, we have also your resonance. Resonance is the percussion sound that is assessed when percussing the lungs, the normal lung tissue. While as your hyperresonance, these are percussion sounds heard upon percussing a hyperinflated lungs, such as patient with chronic obstructive pulmonary disease or COPD. Okay? So the last physical assessment technique that we use is auscultation. Auscultation is the examination using a stethoscope to listen for any sounds that produced by the body, such as cardiac sounds, heart sounds, or yung lung sounds, or you have your bowel sounds. Now, auscultation is the process of using the stethoscope. As you can see here is the stethoscope and with their parts. So we use this instrument to perform auscultation. interpretation. Now, when you do this physical assessment techniques, you can now gather objective data. So, now, who are the sources of data? So, we have primary, which is our patient, okay? And secondary, if it's coming from the family members, okay? If it's coming from medical records, especially if the patient has been or have been confined from other hospitals, so definitely we can get a copy of the medical records of the client, or coming from any members of the healthcare team, including the physician, the midwives, the dietitian, the nutritionist, medical technologist, radiologist, anyone who is included in the care of the patient is main source or a secondary source of data. Okay, so now let's proceed to diagnosis. So after gathering those types of data, subjective and objective data, we will go to diagnosis. Now, what are we gonna do in this phase? Now, we will do interpretation or analysis of data. We will now identify health problems, risks, and strengths, and to formulate nursing diagnosis statement based on your NANDA or yung Packet Guide of Nurses, North American Nursing Diagnosis. So we use this nursing diagnosis, which is very different to medical diagnosis, because medical diagnosis is merely diseases. Now here, we're not focused really on the diseases itself, but rather on the needs of the patient. Okay? So, in prioritizing diagnosis or in prioritizing health problems of the patient, do not forget to use or do not forget the ACB or ABC. The airway, the circulation or the breathing, or in other arrangement ABC, airway, breathing, and circulation. Because if there is a problem within these three main or emergency cases or emergency situation, problems in the airway, problems in circulation, and problems in breathing, you have to prioritize that problem of your patient. Okay, so it's part of triaging, no? Identifying who needs most attention. Okay, so diagnosis has three parts, or the nursing diagnosis has three parts. Namely, we have the mnemonics PES or PES. Okay, so P stands for your problem. It describes the client's health problem or response. This may require a specification or qualifiers added to give additional meaning, such as deficient, impaired, decreased, ineffective, and compromised. So another part after the problem part, okay, usually the first part of the nursing diagnosis represents the problem. Okay, now after the problem, you will now look for the etiology. Example, acute pain. Why did the patient experience acute pain related to surgical incision? Because the patient had undergone surgery. So, related to surgical incision. That is the etiology or the cause of the problem. So, etiology identifies one or more probable cause of the health problem. It gives direction to the required nursing therapy and enables the nurse to individualize the client's care. So, this how we differentiate the needs of the patient depending on the related factors, because patient can experience acute pain, however, the cause is very different. One patient can experience acute pain due to disease process because the patient is having infection or inflammation on a certain part of their body. Now, another patient will have experienced acute pain due to fracture. Another patient will experience acute pain due to difficulty of breathing. So the related factor is, or the etiology will give us the direction to focus on there. Okay? To focus on that specific problem. Because if we were to identify the etiology of the problem, then we can redirect our interventions to solving the or to removing the cause of the problem, so that if we remove the cause of the problem, then there will be no problem. Okay, another is the last part of your diagnosis is signs and symptoms, or the defining characteristics. So we usually use the term or the phrase as evidenced by, which is joined by the first two parts. So example, the thing that I have given earlier: acute pain related to surgical incision as evidenced by history of appendectomy. Okay. So, bakit or why did the patient experience acute pain? Because of the presence of surgical incision. What was the cause of the surgical incision? Because of the history of appendectomy. So that represents your nursing diagnosis. So actually I have here some examples para so that you can understand it more, okay? So I'm very sorry if I have or I mispronounce some words, or somewhat I include some Tagalog words, because I'm really not that fluent in speaking English, especially when in class, because I'm really what do you call this? Um, when I give instructions, when I give discussions in my class, in my face-to-face classes, it's usually in Tagalog and in English. So it's a mix of Tagalog and English. So bear with me, for I am trying my best to really give you the information that you need in straight English. Okay, so here are the examples. So first, the problem is ineffective airway clearance. Now the etiology is the related secretion. So we use the term related to if we were to explain or they call this describe the etiology. Okay, so again, ineffective airway clearance, that's the problem. Now if we were to add the etiology related to certain secretion, and if we were to include again or add the signs and symptoms, so we will use as evidenced by nasal flaring. So here we can identify that the reason why the patient has ineffective airway clearance because of a retained secretion, and it was supported or it was seen because of the nasal flaring. So another example, deficient knowledge related to misinterpretation of information as evidenced by inaccurate return demonstration. So because of misinterpretation of the information that you have given after a health teaching to the patient, so the patient cannot perform the return demonstration of the specific procedure. So that's a problem. Another also, we have spiritual distress related to separation from religious ties as evidenced by crying and withdrawal. So these are just some examples of diagnosis or nursing diagnosis that we can come up with certain types of patient. Okay. Now, there are different types of nursing diagnosis that we can formulate. First, we have the actual nursing diagnosis. Now, when we talk about actual, so from the word itself, actual, it is the client's problem that is present at the time of the nursing assessment. Okay? The moment you had done your head-to-toe assessment or gathering data, you have seen that the patient had an actual problem. So you will now make an actual problem of the patient. So example, so we have here acute pain related to fracture, ineffective airway clearance related to retained mucus secretions. Okay, so on and so forth. Just make sure that it is the client's problem on the present time during your assessment. So another type of nursing diagnosis is risk. Now, this risk nursing diagnosis is usually used if there is no actual problem on the patient. So this indicates that a problem does not yet exist, but there are special risk factors that are present from the patient. So example, the patient had undergone surgery. Now, there's a open wound, okay? Now, the patient, you have seen the patient, he or she has a poor grooming or poor hygiene. he or she doesn't know how to do wound care. So that's a risk factor. However, there's still no problem because there's no signs of infection, but there are certain factors that could contribute to an actual problem. So you can use this one. So such as, example, risk for infection related to chemotherapy. Why? Because remember, in the disease process or in the treatment regimen of chemotherapy, it also affects the normal cells of the body, not just the cancer cells. So once we deprived or once the chemotherapy agents damage also the normal cells, then it will decline or it will cause a decline in the immune system. So we will not be able to fight any form of infection. So another is risk for impaired skin integrity related to immobility. Again, risks are risk indicates a problem does not yet exist. However, there are special risk factors that is present to your patient that may contribute to a larger problem or an actual problem. Now, another type of nursing diagnosis that we can use is wellness diagnosis. So what does the wellness nursing diagnosis indicates? This indicates the client's expression of a desire to attain a higher level of wellness in some area of function. So usually this is used when the patient is able to discharge or may go home after tests from the doctors. So if they're capable of returning to their normal to their they call this normal daily activities of daily living, if they can do that one, then the patient now indicates an expression of desire to attain a higher level of wellness. So we can use the term wellness or readiness or potential na terms, okay, to represent wellness diagnosis. So we have readiness for enhanced family coping or potential for enhanced nutrition. So another type of nursing diagnosis, so we have already discussed the actual, the risk, and the wellness. Another type is possible. Possible statement about a health problem that the client might have now, but the nurse doesn't yet have enough information to make an actual diagnosis. Now, this is usually done if the patient is an emergency or emergent patient or needs an urgent attention. Example, the patient was brought to the hospital unconscious. Okay. Now, you cannot gather enough data, right? Because the patient is unconscious. Now, you can ask the SO but limited information. So, we can use possible diagnosis to identify na maybe this is the problem of the patient, that's why it happened. Okay, so again, possible, these are statements about the health problem that the client might have now, but you don't have a clear picture or enough information to make an actual diagnosis. So example, possible self-esteem disturbance related to recent retirement and relocation. Okay, so another or the last type of your nursing diagnosis is your syndrome. Syndrome is used when cluster of nursing diagnoses are often seen together. At least two or three nursing diagnosis is seen in one patient, so we can use that one as a syndrome. So example, we have rape trauma syndrome related to anxiety about potential health problems as manifested or as evidenced by anger, genitourinary discomfort, and sleep pattern. So we have here different nursing diagnosis. We have the anxiety, because anxiety can stand alone as a nursing diagnosis. We have sleep pattern or sleep pattern disturbances, and we have also the rape trauma. So these three represents clusters of nursing diagnosis, so we can use the term syndrome. Okay, so again, we have 5 types of nursing diagnosis: actual, risk, wellness, possible, and your syndrome. So any of the nursing diagnosis, basta only if just make sure that it is applicable to your client or patient. So that's all for your diagnosis. So after getting data, after doing the assessment, after analyzing the data and making a nursing diagnosis, now we will plan for activities. We will go to planning phase. Now, planning phase is the process of developing, prioritizing plan of care, establishing a smart goals in order to achieve a desired outcome. So this mnemonics SMART stands for S for specific. Okay, so you should have a specific goal. M, measurable. So you can measure. You have a scale, you have any measurement that could really check if you have achieved your goal. We have attainable. Okay? Next, realistic. Okay? And lastly, time bounded. So again, in establishing your goals, it should be specific, measurable, attainable, realistic, and time-bounded. Now, in planning phase, we also formulate goals or desired outcome. It may be a short-term goal or a long-term goal. So when we say short-term goal, it takes hours, okay, to achieve that goal. And when we talk about long-term goal, it takes days or weeks, even months or years to achieve that kind of goal. Okay? So, we will now select and write nursing interventions during this planning. Now, again, I've mentioned nursing interventions can be independent, interdependent, or, again, independent, dependent, or interdependent. So, you will identify what are the interventions independent. You will start first with independent and then afterwards the dependent and then the interdependent nursing intervention. So that's all about planning. You just have to set your goal. You just have to set your objectives, your desired outcomes. After that, you will plan for your activities. Now, if you have already planned your activities, okay, you will now implement it. Now, the implementation phase is implementing consists of doing and documenting the activities that are specific nursing actions needed to carry out the intervention. The nurse performs or delegates the nursing activities for the interventions that were developed in the planning step and then concludes the implementing step. The moment you have started to implement what you have planned until to the last step or last activity that you have planned, that ends the implementation. However, the implementation is the longest part or longest phase of the the ADPI or your nursing process. Because this is the time you collaborate with your patient. Now, if the patient is cooperative, collaborative, that's good. Because it will lessen the time that you will implement the activities. However, if the patient is uncooperative, okay, doesn't want to be bothered, then definitely it will take a lot of time to achieve your desired outcomes. So you really have to make sure that you have already established a good relationship and good trust or rapport with your patient so that you can implement interventions that would help or improve their well-being. Okay? So now, after implementation, we will go to evaluation. Now, in this phase, from the word evaluation, we evaluate the planned, okay? We understand the activities that we have done to our patient. So in this context, evaluating is a planned, ongoing, purposeful activity in which clients and healthcare professionals determine the client's progress towards achievement of goals and outcomes and the effectiveness of the nursing care plan. So here, we will now reassess the patient because we can never identify if the patient or the nursing care plan was effective if we will not reassess the patient. So we will have to compare the baseline data to the final data that you have gathered from your patient. So after comparing the two data, then you will now identify if the nursing care plan is effective and the progress of the client is to achieve the goals of the outcomes. Now, evaluation can never be can be not good, okay, because it depends really on the recovery of the patient. It can be a good evaluation or it can be a bad evaluation. Now, if it's bad evaluation, you have to go back to the plan, the different phases, because maybe there was a problem during your planning. Maybe you write too much, or you planned a higher goal, or you set a higher goal that is not really applicable to your patient, or you planned activities that is not applicable to your patient. Okay? Remember, nursing process is a systematic method in order to individualize care for the patient. Now, again, if if these two patients have the same diseases, it will never be the same when it comes to identifying the needs of the patient, because we are unique. We are different from one another. One patient needs, maybe a patient can experience headache during increasing of blood pressure, but the other one can experience redness or flushing. So it is never the same among patients. So you really, really have to integrate plan of activities that is really needed by the patient, and what do you call this, individualized nursing care plan. Okay? So, I think that ends my discussion for this video nursing process. So let's have a recall of the things that we have discussed. Again, nursing process is a rational and systematic method of identifying the needs of the patient. So the purpose of your nursing process is to identify the health status of the patient, to establish plans to meet the identified needs of the patient, to implement interventions that are most needed by the patient. So we have assessment, diagnosis, planning, intervention, and implementation, and evaluation. Assessment is the process of gathering data, either subjective data or objective data from the patient. After gathering the data from the patient, we will now diagnose the data. Analyze the data during diagnosing phase. Now, after we analyze the data in the same phase, diagnosis, we will now establish nursing diagnosis. So after coming up with a nursing diagnosis, we will go to planning, in which we will plan and set goals or desired outcomes, or plan nursing interventions such as independent, interdependent, dependent, interdependent, and the independent nursing interventions. After planning, we will now implement. We will now implement those planned activities during your planning phase. After your implementation, then we will go to the fifth phase of your nursing care plan, nursing process, the evaluation. You will now reassess the patient if you have achieved the goals that you have set, and if there is a changes on the health status of the patient. So, if you have any clarifications, do not hesitate to ask questions. Okay, so thank you for watching this video, and see you, or let's have another video for another topic or for another unit. So thank you, and wassalam.